One of my fields of expertise is treating co-occurring disorders. And by that I mean individuals who have a substance use disorder, alcoholism, drug addiction, and a psychiatric disorder. There is a relatively high incidence of psychiatric disorders in the addicted population. Sometimes making a diagnosis is very difficult, but it's very important that a diagnosis be made because recovery depends on treating both diagnoses. You can't expect to treat one successfully, for example, depression, when somebody is actively drinking as an alcoholic and get a good response. One really needs to treat both disorders either at the same time or for somebody in recovery to treat the secondary disorder as soon as it's diagnosed. The chances of prolonged recovery are much greater when you treat the co-occurring disorders, and that means treating both of the disorders. I often see patients who have been in a program or in recovery or abstinent for a period of time, up to years in fact, who've been miserable with depression, haven't functioned well, are unhappy, and eventually they seek psychiatric treatment because they don't know what else to do. The fact is, for all those years, they've had a depressive disorder that isn't going to respond to their usual program measures or willpower. It requires psychiatric intervention and most likely psychotropic medication as well. When the two are treated, both of them, the chances of recovery are much enhanced, and there's a much higher recovery rate. It's a real disservice to know that there are patients in the community who get good substance abuse treatment, but they don't get any treatment for their anxiety, their panic attacks, their depression, their PTSD, whatever it might be. And those people deserve to be well, feel good, be productive, and be happy. And that can be facilitated now. But you really need to have some expertise in treating the co-occurring disorders in order to be successful in doing so. If you have any questions, would like to make an appointment, give me a call at 908-305-6404.